Welcome back. Today, the nation's top doctor declared a new public health emergency for something that kills more than 48,000 people a year. But it isn't a disease or a virus, it's guns. In a historic announcement, Surgeon General Vivek Murthy declared firearm violence a public health crisis. That comes as we approach the midway point of a year in which at least 249 mass shootings have been reported in the U.S., according to the Gun Violence Archive. That's roughly 3 mass shootings every 2 days. Dr. Murthy explained his decision this morning on MSNBC.
It is a public health issue that merits a public health approach. And we've taken public health approaches to challenges like tobacco, car accident-related deaths over the years. And we've been able to reduce the toll of those public health challenges. We can do the same thing here with gun violence, and it's urgent that we do so.
And I'm joined now by Dr. Megan Ranney, Dean of the Yale Public School of Public Health. I want to say, of course, that you, of course, pushed public health approach to gun violence just last month. You're here now, and I want to, in some ways, talk to you about what the significance of declaring gun violence a public health crisis is.
Yamiche, I am not just a public health professional and dean, but also an emergency physician. Over the course of my career, I have taken care of hundreds of victims of gun violence, gun homicide, gun suicide, gun domestic violence. But it's not just taking care of the people who've been shot. I've also taken care of their mothers and fathers, their siblings, their community members, their friends, each of whom experience health harms from a gunshot wound. And the Surgeon General labeling this epidemic as what it is, a public health crisis, gives us tools and a forward path to try to reduce those health harms. Certainly to reduce the number of people who are shot and killed by a gun each year, but also to address that horrible ripple effect that this epidemic has on our American society.
And as you just said, you know, you have a holistic view of this from a number of different angles, including, as you said, talking to the families and those who are left behind with this gun violence. You wrote about a 4-step process to addressing gun violence as a public health crisis. What are those steps?
So the first step is that we measure it. We say, how common is it and who does it affect? The second step is that we evaluate who's at risk or who's protected. All other things equal, what makes someone more likely to be on the wrong side of a gun or less likely to get shot? Then, using those tools and those analyses, we start designing interventions. We try to figure out what might work to protect people or to reduce the risk of harm. That might be economic incentives, things like how, you know, for driving, you get a bonus on your insurance if you haven't gotten a ticket or haven't gotten in a crash. Maybe there are economic drivers we can use to reduce the risk of harm. Maybe there are individual level educational programs. I'm working on some of those myself with programs like 4-H on a national level to help reduce the risk of kids, parents, or instructors being involved in shootings. It might be structural change. Things like putting in gardens into vacant lots have been shown to reduce the risk of shootings in the community around them. And of course, there might be policies that make a difference, laws like safe storage laws or red flag laws. So after that third step, where we've developed and tested interventions, the fourth step is that we scale up what works. We don't waste time or taxpayer dollars on doing things that aren't going to make a difference, but we take the tools that we have and put them out in place.
And as you just laid out those steps, do you think that the Surgeon General, that his declaration today is following part of the approach that you just outlined?
Very much so. When you read that report, really the first part of it is laying out those numbers. How common is it? Who does it affect? We know, for example, that gun deaths, about 2/3 of them are suicides. Those mostly affect older white men, but gun homicides disproportionately affect young Black men. He talks about that and more, the data behind it. Then he talks about what do we know about risk and protective factors and what don't we know. He calls for better data. You quoted, Yamiche, the Gun Violence Archive, which is an amazing source of data on gun shootings across the U.S. That's a nonprofit. It's crazy that we have this epidemic and we don't have good government or hospital data on who's getting shot and where. The Surgeon General calls that out. And then he highlights the things that we already know that work and the need for more research to give us more solutions that are acceptable and usable by communities. He calls out the importance of a harm reduction approach where, of course, we'd love to get to 0 injuries or deaths, but gosh, I'll take any progress right now. And he talks about some of the ways that we can get there.
As he talks about that, he also talks about the politics. Here's what he told the New York Times. The Surgeon General said, quote, "This issue has been politicized, has been polarized over time. But I think when we understand that this is a public health issue, we have the opportunity to take it out of the realm of politics and put it into the realm of public health." Now, of course, I cover politics, and I've seen this issue be really polarizing to Americans, to politicians. Do you think that you can really treat gun violence as a health crisis without also politicizing this issue?
Absolutely. I'll give you a couple examples why. The first, of course, is that no one wants their loved one shot or killed by a gun. And so that's the first way that it depoliticizes it. It puts us all on the same page. The second is a very personal example. I testified for the Senate Judiciary Committee last November around exactly this issue. And I will tell you, we had folks from both sides of the aisle that were fully supportive. And we've seen this, of course, in the bipartisan Safer Communities Act that was passed last year, co-sponsored by Senator Cornyn and by Senator Murphy from Connecticut. So there's great, actual, tangible examples. And then the third thing, Yamiche, is that I actually think this is a space for media to step up. So often coverage of these horrible shootings happens only from the political perspective, instead of also talking about how we as healthcare providers or public health professionals can help make a difference, can provide healing, and can most of all provide hope to a country that I too often worry has become numb and hopeless and has just given up on trying to address this issue.
Yeah, well, this is certainly an issue where I know a lot of people would want hope to be there. Thank you so much, Dr. Megan Ranney, of course, the Dean of the Yale School of Public Health. Thank you.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.